Diagnostic wax-up. There are 4 reasons you should consider doing diagnostic wax-up. Reason number 1 is visualization. You need to be able to visualize how the end result will look like. And this is a great tool to make patients visualize themselves how they will look, because maybe you have done hundreds of full mouth reconstruction and you know exactly what the result will look like, but patient cannot imagine how it will look like in their mouth. And that is where diagnostic waxes come in, and it will help you amazingly when you are using it correctly. Number 2, it will help you with communicating with patient. Patient will be able to see the shape and size of the teeth, or the position of the teeth, and the aesthetic, the smile. So if they do not like it, this is the right time to stop the treatment and think it through before you do anything irreversible. It will help you with planning as well. So when you are doing treatment plan and you're not sure how much occlusal vertical dimension you're going to raise, and you just raised appropriate to the aesthetic results, but then the posterior restoration, you don't have enough space for indirect restoration. And then that means you need to plan that area in order to do direct restoration, and that will change the treatment plan, that will change the strategies. Are you going to use a stamp technique, which I teach in my FMR courses, which is amazing. Once you've done the diagnostic wax up and you've got the stents ready, it doesn't take that long, probably 15-20 minutes per tooth. So it's really quick and easy to do a occlusal coverage restoration in an ideal occlusal position. But you won't know whether you have enough space for indirect restoration or direct restoration before you do diagnostic wax up. And that's why many times I tell patients that, look, I cannot give you a 100% accurate estimate of the treatment until we have gone through the diagnostic restoration phase, because patient may not like, you may have planned, let's say, palatal buildup and incisal buildup, but patient may not like the fact that you're not doing anything on the buccal area, like veneering. Now, as we both know, that when you do veneers, obviously it increases the cost of the treatment. Now, if you haven't implemented that in your estimate, and then at the end of the treatment, patients are like, oh, I don't like the aesthetic, can you do the veneers? And they say, yeah, of course I can do veneer, it will be this much. And patients are like, look, I didn't budget this, you did not tell me. So to avoid all these complications, make sure you do diagnostic wax up. Number 4 is provisional restoration. Again, when you are doing diagnostic wax up, let's say if you're doing a direct full mouth reconstruction, most of the time there is no provisional restoration. However, what I tend to do is give patient a mock-up using my diagnostic wax up and let the patient go with it, so that patient has some time to go through how the aesthetic will look like, how the teeth will feel, whether they're going to have any issues. I have covered that a bit more in detail, where risk assessment for FMR cases. So watch that video. But these are the 4 reasons why you should consider diagnostic wax up: visualization, communication with the patient, treatment planning, and provisional restorations. If you want to learn more about full mouth reconstruction, then on 28th of January, I am doing free webinar where I'm going to go through FMR case selection. I'm going to go through treatment planning for full mouth reconstruction of one of my case, and I will also be answering a question on full mouth reconstruction live. So make sure to join on 28th of January, and I'll see you there.